Thank you very much for inviting me to speak at European Public Health Week. It seems an important moment, doesn't it, in terms of the current world pandemic. What I will do this afternoon is cover why communities need to be at the heart of a modern public health. So I'll take a public health perspective on communities. I want to think about two particular concepts, community action and community resilience, in terms of the current COVID-19 emergency and planning for the recovery. And then at the end, to sum up a couple of things around how we might move from evidence into action to build stronger, more resilient communities. And as Greg said, I, as well as a research role as a professor, I also have this national role in Public Health England, but the views in this presentation are my own today. So, okay, let's start with the basics. And I think a lot of you sort of tuning in today will be really aware of the importance of community participation for health promotion and public health. And in England, we are working with the idea in Public Health England that communities need to be at the heart of public health. They can help reduce health by involving people. It helps reduce health inequalities. You need to be empowering people to have a greater say in their lives and health, and reaching out to people who are most at risk of the impact from inequalities or from poor health and risk factors around behaviours. And finally, involving communities and putting them at the heart of public health can create connected, more resilient communities. So if we look at why we're saying this, and this is just a summary of some of the evidence, we know that there's a huge amount of review evidence by people like Sir Michael Marmot and others around the impact of health inequalities and the types of determinants that drive inequalities. And we know that these are a mix of socioeconomic deprivation, but also things like marginalisation and powerlessness, which affect people's health. But we also know that at a community level, that the extent to which we have control over our lives, the quality of our social relationships, whether we have good social networks and trust in our communities and safe neighbourhoods, are all important influences on health. And these can be really protective of good health and can buffer against stressors and risk factors. But obviously, even in those community level determinants, there are inequalities. And so there are people who remain marginalised and disempowered, who have poor social connections and feel little sort of control over their lives and their health. And obviously those are is intimately connected with inequalities. We also have a huge evidence base in public health on what we call community-centred approaches, which can help build connected and empowered communities. And we know particularly that participatory approaches that involve the people who are most directly affected by inequalities in health can be used very effectively to address that marginalisation and design and deliver good public health programmes, in partnership with communities. And finally, it links to an emergent evidence base at the moment around assets for health and the things that we are taking an asset-based approach for health. So that's really a summary of the evidence. And also we need to acknowledge that pre-COVID, and this sort of long tradition of many different approaches to community engagement and community participation. And in Public Health England, we work with the notion of a family of approaches. There are different ways to do this, and they each have an evidence base. But it isn't just a matter of doing community-based or community-centred interventions. We also need to think about the the system of prevention. And I draw here on the work of the Prevention Institute from the States, who have been putting together the years of practice and evidence to think about what a public health system should look like. And in this diagram, which I hope you can see, you'll see that there's sort of tandem bicycle, which underneath it, sorry, it's not sort of little detail there that I hope people can see, but it says elevate community voices and leadership. And so you have, in a system, you have the community voice and leadership, community organisations powering the cogs, the community partnerships and the multi-sector collaboration. And then it goes through that system to, you know, getting the funding, to advocacy, to taking the prevention efforts that are needed. And it's this system approach that communities are at the heart that is also, there is an increasing evidence base for. So that really was sort of covering some of the basics of why we think communities are important to public health. And I now want to turn to the notion of community action and resilience in a time of crisis, and particularly the COVID emergency. When we look at a lot of the stuff coming out from WHO Europe and Dr. Hans Kocher, the regional director of Europe, many statements which remind us how important community action is in addressing and dealing with the pandemic. And here his quote, reminding government and communities that all communities must be supported with interventions. This statement's particularly around older people. Make sure that nobody is left behind, and community action is part of that. So if you feel your community needs support, now is the time to step up. I'm going to give you some examples from the UK, but this statement by Dr. Klucher does also highlight the work going on in the Netherlands and Spain, where similar levels of action have been seen. But in the UK, we've seen a response, really, let's call it a solidarity response, where we've seen the growth of mutualism in response to COVID-19. And our Office for National Statistics are currently measuring the social impacts of the pandemic. So last week, they found that around 80% of people said they thought people were doing more to help their community during the coronavirus pandemic. And not just felt that, over half, 55%, they had checked on neighbours who might need help at least once. And 31% had said they'd gone shopping or done other tasks for neighbours at least once. And we're seeing on the ONS statistics, this is early days, a growth in the response of the community to people who need to shield and self-isolate and have other needs. But I should stress this is in relation to need, and there are very high levels of need in some communities. And one example of this is our Trestle Trust, which coordinate food banks in the UK, report an 81% increase for emergency food from food banks, including 122% rise in parcels given for children. And if I give another example now, a really excellent report that has been excellent report that has been published last week on how to sustain community spirit beyond COVID-19. And here you see that this report's about how communities organise at a community level. And there are these sort of nearly 3,500 registered mutual aid groups in England that have been set up. Now, a lot of these will be set up in areas that already have good economic and social capital. However, there are also a number of mutual aid groups, and you see a response in the most disadvantaged communities where people have very little, but they're giving to each other's and their neighbours. And I love this quote, that this report is very clear that communities can organise rapidly, and I love it, move at the speed of trust. And they conclude that community spirit is everywhere, but we need to be mindful of inequalities because some places and also some people need support. It won't just happen spontaneously always where there are, inequalities exist. So what do we do? Thinking back to that public health perspective, what does that mean for us? And I think that this quote very much sort of emphasizes this, again from America, pre-COVID, 2011, but it talks about a community ecology, understanding the communities as concept systems, which include local conditions, community groups, the relationships between groups in the community and the relationships of groups external to the community, local resources, networks, social capital, and then the impact of macro policies. And I think that understanding in public health that communities are very rich, multi-layered, complex and dynamic systems. They're not a blank sheet of paper in which professionals come along and then dump from on high an intervention. That's really important, I think, to modern thinking on public health and communities. And it also relates to much of the work that's been going on, led by many people, including Anthony Morgan and Erio Ziglio in Europe, around the asset-based movement for public health. So getting a better understanding of the assets within our communities, many of which are the community organisations, the volunteers and the social groups. And we come out with pictures of communities that understand the assets as well as understand those public health deficits. And this enables us to build action. I said I was going to talk about community action, but also community resilience. But it's important to understand within that what the community contribution is. And I think for public health, this isn't just about people spontaneously helping others. It's about the skills, the local knowledge and the lived experience that community members bring to public health that can't be captured in other ways. And that these people, whether they're formal volunteers, community health workers, lay health workers, or helping informally, they're able to bridge and connect and reach the people who often professional services are unable to reach. And by doing that and working with individuals, you build leadership and capacity in communities. Turning now to the concept of community resilience, which I'm increasingly thinking is going to be a key concept for the recovery period with COVID. We know that resilience is not just coping with adversity, it's a dynamic process in which communities or individuals respond, withstand, adapt and ultimately thrive, hopefully, in response to stressors. And I think the stressors can come from many areas, but the post-COVID-19 emergency will have all of these stressors in place. And the WHO Europe have been doing a lot thinking about building resilient communities as part of a public health response. And here we have the work we did for them a couple of years ago was on measurement, but trying to encapsulate the areas we were interested in community resilience in the public health field. But it's about emphasising those community level determinants that have been identified as so important as protective factors, trust, connectedness, and so on. Is very much located within an asset-based approach to health. So building on those resources that are already there and understanding those. And then again, linked to place-based approaches that are taking action at a local level, planning for local populations and having an integrated multi-sectoral approach. In this work we did for WHO, we took it was a literature review looking at different international frameworks and trying to understand what were the most important ingredients to measure or indeed to act on community resilience. And not surprisingly, the social aspect, these protective factors that help communities respond to adversity came up very high. So things like family structure, the number of people living in single or with other people, the social networks. The economic factors are important. Communities that are live in areas that are sort of post-industrial or have economic pressures will find it harder to be resilient. Skills and education are important. Environmental factors, the quality of our physical and green space. Civic participation, whether communities are able to take part in democratic structures and have their voice heard, volunteering and a state of civil society, community organisations, community safety and local services. And when you look at community resilience, hopefully some of you are thinking, well, that just looks like the wider determinants of health, and it does. And the point being that community resilience, if we are to build the resilience of our communities, there needs to be action across those wider determinants, but thinking of that community level and how that works. Two very quick case studies, because I don't want to go on too long and give you a chance for questions and so on. But these are, again, not at all about COVID emergency, but I think offer two different sort of approaches. But one, we found a really great case study, which is in the report, from Arizona. And the key point being, this is a real public health approach to take an intersectoral approach to look at regional vulnerabilities and assets at the same time, and to bring civil society organisations and communities into that dialogue to develop a local action plan. It seems very simple on the surface, but very effective. And then a further important point, the importance of doing real in-depth work, whether that's by research, using qualitative research, participatory methods, or through other participatory methods that aren't research, but to provide an insight into what matters in individual communities. And this is a case study we draw on around a small Norwegian village that had got a lot of stresses, environmental and economic stresses happening. But the things that people found in their community were helpful to building an action plan to move out of that situation and become more resilient. And they're all these sort of social factors that are so critical. So I've been thinking a lot about community resilience, and I haven't got all the answers, and a lot about the levels of community action we're seeing in the COVID-19 pandemic. And I've just put some ideas down in terms of how that might apply. Really not as sort of recommendations, more my thoughts. So how do we put the public into public health during a time of crisis? Based on what I've said before, we need an understanding of community action, not just the numbers involved. We've got something like 750,000 volunteering have come forward to volunteer for our National Health Service, but also the types of contributions that people are doing. It's having that public health understanding of community. We need to use community-centred approaches that start to build on those social connections and knowledge within communities, and that create the conditions that enable people to be involved. A lot of community action during a pandemic will occur naturally without any public health sort of intervention to do that. But where it doesn't and where there are vulnerabilities, public health need to be there helping that process and supporting that process. We need to never forget the equity element. So public health needs to focus on community vulnerabilities, addressing inequalities and involving marginalised communities who have least voice in it often, in planning and assessment in order to be able to build community resilience. And finally, a recommendation from that WHO report, but to embed measurement of community resilience within public health planning frameworks and link to actions to strengthen communities. This is all can be done now and in the following, the coming months really. But that leads on to a broader issue, which I think relates back to that system stuff I mentioned at the beginning, that we need a sort of new sort of public health leadership to nurture resilient communities, so that where do we want to be? That communities become the starting point, that is central to how we achieve better health and care, reduce inequalities and recover from the COVID-19 emergency. And that requires us not just to do stuff at a community level, which is vital in public health, but also to develop public health systems that support and enable more resilient communities. And I've put up this figure, which comes from the King's Fund, that of an integrated public health system, where you've got the health and care system, work on the wider determinants, health behaviours, and the communities we live in and with. And it seems to me that it's that type of integrated public health system, which also mirrors much of the Health 2020 from WHO Europe, that we need to be building. And this requires a leadership for a radical shift, really, towards community-centred public health. And I will leave it there with a quote from some of these arguments are put in a recent article I wrote with colleagues from Public Health England. But I think it's about whatever the new things are on the block, and we have many new things and use of digital technology and so on to keep communities together. Public health needs to remain rooted within the communities it serves. And we need to put the public squarely into public health at the heart of everyday practice, planning, delivery, and also, I believe, research. Thank you very much.
Thank you very much for that talk, Jane. We've had quite a few questions here, so I'll just go through them. The first one we've got to ask you is, do you feel there is often a disconnect between how bodies like local authorities think how close they work with communities and how close the actual communities feel about that?
I think that varies a lot in different places. I think there are many examples of local authorities in the UK, municipalities, that have got those long-term relationships and partnerships, and it goes back to that system response. If you've got your community collaborations and alliances in place, you're in a good position to respond to something like a pandemic, however much that sort of level of demand needs to be upped. And it's about that sort of speed of trust again. But I think there is a sort of a disconnect where civil society organisations have really stepped into the gap in this level of need, and now it's important. I don't want to sort of lay the blame on where that disconnect comes, but it's important that I think those sort of municipalities and public services sort of meet those civil society organisations in the middle and understand what's going on, and then be able to respond and sort of build that's a resilience at that level. It's really critical for that partnership approach now.
Thank you. I think you somewhat answered that for the next question, but I'll just ask it anyway. So how do you get past the notion that community actions come and go, where a lot of people in the community feel things have been done to them several times, but nothing really sustainable?
Yeah, I mean, I think that there's two things in that, isn't it? Community actions come and go. There will be what technical term, episodic volunteering. You will see sort of rises and peaks in people's action according to different, I guess, different stimulus, really. But this has been a huge stimulus for community action, and there's nothing wrong in that coming, building up and sort of fading away again. You get it also with things like the Olympics or whatever. But there's a key question here is, what is, for public health, the relationship with communities over time? And that's where it is vitally important that we think about those inequalities issues, which is around power and powerlessness. So it isn't just bringing communities, wheeling them on and wheeling them out again. It's about those long-term relationships that try to equalize power in some way, and allow people a chance to shape what's happening in their local area, or in some cases if their community is a community of interest. So at the heart of all of this is power, and I don't think public health can completely overcome all the power inequalities, so globally, nationally, locally, but we should be trying to work in ways that equalize the power a little bit more, and particularly put those communities who have been most affected at the central of planning and delivery. And that requires, all the community development literature requires long-term sustainable action, not tokenism.
Thank you. And another one, so what is the role of virtual communities in this pandemic in particular?
I think that's to be researched if anyone wants to do it. A lot of people talk about digital communities, virtual communities, and the as far as my understanding of it, it's not particularly my area of research, but up until this sort of recent period, the sort of jury's been out on whether that's as effective as the normal ways we do community things, because the normal way of a community project is to come together and share food, frankly, and do all the things we can't do at the moment, and people have a chance to come together, and that's what they often appreciate. So I think what's really interesting is how the sort of digital space has become much more creative about keeping people together. And clearly it's been part of how communities are mobilized and able to identify need. And so I think we need to be thinking creatively about how, as well, from a public health perspective, we respond to that. But of course, recognizing that there are groups who are digitally excluded, and how we can, particularly in the recovery, how we can address that by perhaps having a more blended approach. So I think there's plenty of research to go at to sort of find out how that works.
Interesting research topic for someone that might be interested. So I just got a final couple of questions. One is, you mentioned the Trussell Trust, which is a faith-based organisation. And so do you find that there can sometimes be barriers for people getting involved or making use of some community services like this? And how might people be able to get around that?
Yeah, I think in some countries, the faith-based organisations are a key, and the evidence shows us that are absolutely key to the sort of culture and the way in which communities organise. And we do have to be mindful that that may exclude some people because they don't feel as comfortable but that's true of any sort of community organisation in a way. They won't cover every single member in the community. So it's really important that we promote a form of inclusive practice. And I think there are some very good examples. I know certainly in the UK of, give an example, the Wandsworth Community Empowerment Project, which is based in a really poor area in London, and has been working through the Pentecostal churches and the mosques and Sikh temples. But it takes a really inclusive approach, addressing discrimination, addressing marginalisation, and so on. And I think it's, that we need to think about faith organisations as sort of assets in our community. But support them to be as inclusive as possible, really, to break down those barriers.
Thank you. And one final question before we move over to Obo. Do you think that the COVID crisis will ultimately strengthen or weaken communities?
Oh, that's a really hard one. It depends what we do. I think there will be some community networks that will be and ways of working that will be strengthened through the crisis, and we're seeing that now, which is partly why I put the figures up from ONS. And it'll be interesting to see whether that's mirrored in other countries, particularly countries like the Netherlands that have very strong civil society organisations. However, I think that and it comes back to that notion of resilience. You have the sort of a balance really between the stressors, and at the moment we've got a virus is the stressor, the pandemic, but underneath that are some of these huge economic stressors that are going to come in, and we will have to work very hard in public health to make sure that the impacts from COVID are not felt disproportionately in the poorest, least advantaged communities, and that they may feel that they are bearing the sort of brunt of this. And I think those equity issues, which are so central to public health, need to be, when we're thinking about communities, need to be absolutely at the forefront of our mind. It's sort of finished really by saying I think we can celebrate what, if that's the right word, but to acknowledge and value what is in communities and is being done, but to make sure that we keep that equity perspective and support where there are gaps and vulnerabilities.
Thank you very much. And on one final note, I'd just like to say with just somebody's, I don't know whether it's coming on tweet or email, but they've asked to pass on their appreciation to you and that you have just reignited their love for public health as she was on the verge of changing her career. Someone called Malusi. It was via email that, so that's a job well done, I would say.
Thank you. That's a lovely outcome. Thank you very much.